Good morning. Today we'll be talking about kidney health for all, which is in line with the World Kidney Day theme for 2022. Thank you, Dr. Bamgboye, for coming on the program. It's always a pleasure to have you with us.
Thank you, Dr. Pamela, for having me.
Yes,
it's always my pleasure as well.
Yes. We're talking today about kidney health for all, bridging the knowledge gap to better kidney care. And the focus this year is all about chronic kidney disease and understanding it in so many issues. So if we can just start off with understanding what is kidney disease, what is specifically chronic kidney disease, and why do people need to know about it?
Well, first of all, it's always nice to recount that the World Kidney Day is an initiative of both the International Society of Nephrology and the International Federation of Kidney Foundations. And it is marked on the second Thursday in March every year. So this year it's on the 10th of March. And the theme for this year has been kidney health for all. And essentially it's focused on ensuring that people are a lot more aware of the things that can lead on to kidney failure, how to recognize kidney failure, and what your options are when you do develop kidney failure. The focus particularly is on chronic kidney disease. And as you asked, chronic kidney disease is a condition that affects both kidneys almost invariably simultaneously and is by definition an irreversible and naturally progressive decline in function of the kidney. Meaning once we establish that you have chronic kidney disease, you can't reverse it. All that the specialist can do is to slow down progression. It will naturally progress. And everybody with chronic kidney disease, if he lives and survives for long enough, is going to end up at some stage requiring dialysis or a kidney transplant. It's a very common condition, and worldwide estimates range between 10 and even as high as 20% in some environments. We believe that in Nigeria, we probably have about 15%, which is 1 out of every 7 individuals in the country has some level of chronic kidney disease or the other. It's unfortunately a very common condition. I think worldwide, it's believed that 850 million people have chronic kidney disease. And it's not surprising because the things that commonly associated with it are also very common in our environment, are very often not detected early. And even when they're detected, they're often not well managed. So things like hypertension, and as much as between 30 and 60%. Of course, hypertension is when your blood pressure is higher than 140/90 consistently. And you don't manage it properly, almost invariably, with time, you might end up with chronic kidney disease. Diabetes is a very common condition that tends to lead on to chronic kidney disease. And that also is very common and progressively is becoming even more common in our environment. You could have estimates from as low as 4% to as high as 10% in some environments of people who have diabetes. Unfortunately, only 50% of those who have diabetes know that they have elevated blood sugars consistently. And as such, only about 50% of them are on treatment. Only about a third of those on treatment are well controlled. So you find that it's not surprising that chronic kidney disease is a very prevalent condition in our environment.
I think I want to agree with that. And the statistics you're giving are actually quite frightening.
Yes, and the third component of the different things that lead on to chronic kidney disease would be what we call chronic glomerulonephritis. That's a very long medical term, but essentially what it is is an inflammation of the kidney, usually secondary to some other disease going on in the body. And very often, these are chronic infections in our environment. Things like chronic hepatitis B, for instance. And it's estimated that as much as between 8 and 10% of individuals may carry that virus unknowingly in our environment. Hepatitis C, maybe 3 to 5%. HIV, maybe about 2 to 4%. So any of these chronic infections can lead on to chronic inflammation of the kidneys. And an individual can also develop kidney failure from that. Then, of course, there are other less known and less common conditions, things like polycystic kidney disease, which you inherit, various forms of congenital kidney diseases, particularly common as a cause of chronic kidney disease in children, so posterior urethral valves, PUJ obstruction. Then, of course, the abuse of analgesics, even straightforward paracetamol, not to talk of your non-steroidal anti-inflammatory drugs.
That's common
enough. Very common. The abuse of various forms of native medications and herbs and herbal supplements, which all seem to be quite prevalent in our environment. These are other causes, sickle cell disease, also in some instances, that very commonly we see in our environment, and it's not surprising that the prevalence of chronic kidney disease seems to be so high.
No, it is actually indeed very high, particularly in our environment. And from what you've stated now, there's so many conditions. So talking about it, how do you start off? Because that was one of the things you mentioned. How do you prevent yourself from getting chronic kidney disease?
Well, first of all, another angle to it, which I must mention, is the fact that as people in this part of the world, as Black people, we generally tend to inherit a gene which further predisposes us to chronic kidney disease, known as the apolipoprotein 1 gene. It's been found to predominate, particularly in the western part of Africa. And you find that generally tends to correspond to the parts of the continent that have the highest prevalence of chronic kidney disease. This is a gene that was earlier developed, which seemed to protect those who had it from having trypanosomiasis or sleeping sickness. Now that is no longer a prevalent illness in the environment, but because the gene developed, it's particularly common, and we found that those who inherit that gene generally tend to have much higher predisposition to chronic kidney disease. So if you inherit the gene and you have diabetes or hypertension or you have a chronic infection, you're more likely than someone who doesn't to develop chronic kidney disease. And that's why, relative to other ethnicities or racial groups, we generally tend to have a very high prevalence. But specifically going back to your question as to what we can do, I mean, if you know you have hypertension, first of all, you need to know that you have the hypertension. You need to recognize the hypertension is a lifelong illness. It's not something that you get only when you have a headache, as some people erroneously believe. And once you've established a diagnosis of hypertension, treatment is lifelong. So it's not something you take for 1 or 2 weeks, then you stop. And to ensure that your blood pressure is well controlled, you need to go into hospital on a regular basis. And if possible, you actually should acquire your own sphygmomanometer, which is the device that we can use at home. The electronic versions of that you can now use to check your blood pressure, and just make sure that you're keeping the blood pressures within acceptable limits. Ditto with diabetes. Diabetes is also becoming more common because we're becoming more obese. We exercise much less. We generally tend to eat fast foods. And on account of that, we're finding increasingly the prevalence of diabetes is increasing from less than 2% about 25, 30 years ago to much closer to 8.8% now. So if you do have diabetes, and unfortunately only 50% of those who have diabetes know that they have it, you need to make sure that it's well controlled. So you need to have your own small device, which you call a glucometer, to check on a regular basis. You need to make sure that you are eating the right things in the right quantity at the right times. You're checking your blood sugar on a regular basis, and you're seeing your doctors to make sure they're guiding you as to what exactly you need to do. And certainly, if you have chronic infections, these need to be detected. And when they're detected, they need to be appropriately managed. It's not what you go to your local chemist or herbalist and expect that you'll get appropriate treatment that will ensure that you do not develop the long-term complications which very often follow these chronic infections, one of which would be your chronic kidney disease.
So there's a lot to be said for that, but I also want to just shout out to anyone who doesn't do annual checkups to say that all of this is preventing disease when you already know you have an underlying condition. If you continue to not check up and not do the things that are required in terms of actually finding out that you have a condition that needs to be treated, then that in itself, no one can help you. So the first step, I think, is for all the people to screen themselves. No, do you have hypertension? Do you have diabetes? Do you have a chronic illness like hepatitis B or C, as Dr. Bamgboye has mentioned, and which are common in our community? So if we move on from prevention, Dr. Bamgboye, to treatment, how can people, this is specifically for the chronic kidney disease, a person finds out, I have chronic kidney disease, what steps do they need to take to slow down the progression of this condition?
Well, first of all, it's nice to also stress that there are different stages of chronic kidney disease, and these go from stage 1 to stage 5. It is only when you get to stage 5 that you then would require either dialysis and or a transplant, a kidney transplant. So there are many early stages 1 to 4, that are pre-dialysis or pre-transplant, and during which, if you recognize and you manage as appropriate, you can slow down progression. And in fact, in some instances, depending on what is the underlying cause, you can almost arrest any further progression if you do the appropriate things. So the first thing is to even detect in the first place. So like you have rightly mentioned, if you don't know you have hypertension, if you're waiting for symptoms, 90% of those who have hypertension don't have any symptoms at all. And the only way you'll detect it is if you actually go into hospital and somebody checks your blood pressure. Ditto with diabetes. Most people with the early stages of diabetes don't have any symptoms. And even at those early stages, it's still possible for you to develop the complications of long-term diabetes, including the eye, the brain, the heart, the kidneys, and your peripheral nerves, even without being detected that you have it. So it's important that you actually do, I think you call it know your numbers. Periodically, at least once every year at the very least, you go in and get somebody to check the common parameters that you do have. But once you've detected that you now have chronic kidney disease, there are things that you can do that would help to slow down progression in the earlier stages. First of all, is to identify the primary condition leading to it and to control it. So if you're hypertensive, try and control your blood pressure. If you have protein in the urine, ensure that that blood pressure is controlled below 130/85. And if you can, below 120/80. If you're diabetic, you want to keep your blood sugars within acceptable limits, usually fasting below 130 if you can. And more importantly, your glycated hemoglobin, the HbA1c, as the lab scientists refer to it. You want to keep that value, if you're diabetic, to below 7 at the very least. So, of course, the other things you should do, you should make sure that you avoid things that we know are toxic to the kidneys. So you avoid all the non-steroidals, you avoid all the, even paracetamol, any analgesic, but if you must, paracetamol probably might be a more appropriate one than any of the non-steroidals. You avoid any herbal supplements, you avoid anything that potentially is toxic to the kidney. And then, of course, your diet to make sure your blood pressure is controlled, low salt, your diet to make sure your sugar is controlled. Avoid too many refined sugars. But more importantly, you keep the protein content of your diets down to less than 0.5 grams per kg. So to be able to calculate that, you probably might need to see a dietitian. But the rough guide would be that you don't take more than protein the size of my thumb with each meal, which will probably come to about 10 grams. So size of meat, fish, or chicken, the size of my thumb, or an egg will probably be about 10 grams. So if you take one with every meal, you probably would come within what is the acceptable amount of protein that somebody with chronic kidney disease should take in a 24-hour period.
Thank you. So lifestyle modification is key. Diet, exercise, and other things to keep a person healthy. Good morning, sir. Thank you so much for coming on this program to share your experience with us. Can you please tell us, how did you find out you had chronic kidney disease?
Thank you, first of all, for having me on the show. And to your question, I actually had high blood pressure for hypertension for quite a long time. And I was on treatment for it. But I guess my BP then just refused to go down. For quite a long time, I was really high numbers for my BP. And then there was this particular day that I was in bed and then I was coughing all night. I just couldn't sleep. And my daughter had me coughing from her room. And then eventually she came out and insisted we had to go to hospital. We got to the hospital the next morning. And I thought it was something that I'll probably just be giving cough mixture or something. I'll leave. But the doctor I saw then was a nephrologist. And she insisted that she had to run some tests. And I should wait for the results. By the time the results came out, she said she was alarmed at my kidney condition. And that was where matter started.
And where have you gone to with it? How have you had to have treatment for it? Specifically?
Yes, I had yes, when that was discovered, I now had to seek medical advice on it. And then I got directed to the Nicholas Hospital, where I saw Dr. Bamgboye. And then after a series of tests, I had to start eventually at some point to start doing dialysis. And then I ended up with a transplant about the middle of last year.
I really want to appreciate your coming out and coming to talk about this condition, because a lot of people who have conditions don't come out and share the information with others. So you've had to go on dialysis, you've had a long-term history with chronic kidney disease. So what kind of advice would you give to others? Because there are a lot of people out there who have high blood pressure, who may not have taken those high numbers seriously. And obviously you have, you've been on treatment, but perhaps being more aggressive with treatment could have helped you in the long term. Do you think, or could you give any words of advice to our listeners?
The first thing I would say is that when people go into hospital, I think now it's best to insist on a specific doctor to see. Then I think I was seeing a general practitioner. I did not know that I needed to see a nephrologist. So I guess he gave me, the doctor I saw gave me the mildest of medication, which wasn't working for me. So the knowledge for people to know who to ask to see, whatever condition they think they have, is helpful. And then secondly, you don't take, because mine is a fallout from hypertension, you don't take it lightly. I took mine lightly because hypertension, you keep going. You're still there running through your everyday activities. You know, my drugs, but sometimes I wasn't taking on. But now I realize strict with your medication and see a nephrologist who can keep guiding you, testing you regularly.
I think the two things you've said is the importance of seeing a specialist. If you have a special condition, seeing that specialist along with your general physician. The second issue of making sure you take your medications, don't take it lightly. Make sure whatever condition you have, it is controlled. And the third issue, what you mentioned, is external factors and how they apply to you and how you have to manage them. Thank you so much. We really appreciate your coming on this program to share your experience with us. Thank you. For us, I think this whole issue of, for example, primary health physicians, do we find that a lot of doctors listen to this program actually, so you're actually going to be talking to some of them. How aggressive do you think people need to be? Because it is a balance. You see, a lot of people go to the doctor and then they complain, the cost. So people don't do as much testing as perhaps they should do. And then people perhaps don't offer as much testing as they should. But how often, and this is so that people out there who have a diagnosis of high blood pressure, how often should they check their kidney function? And it's not an expensive test. What do they need to do?
I think that, if anything, should probably be the takeaway message from those who are listening on to this program today. I think, and that really is the focus of the theme for this year's World Kidney Day, bridging the gap in terms of knowledge and literacy as regards, your health, as specifically now as regards the kidneys. The fact that the public is not aware, there's not enough information out there for them to act upon. Our primary care physicians themselves probably don't do as much as they should ideally do. And that's why, very often 85% of our patients with chronic kidney disease get to the nephrologist only at the stage where they need dialysis and transplant. And that shouldn't be. There's stage 1, stage 2, stage 3. Those are the stages where, if appropriate measures are taken, things can be done. And then finally, our policymakers, not realizing that the focus should, even in the developed world where they have all the resources you can think of, they're finding that it's well beyond their capacity to be able to deal with the issues after the horse has bolted out of the barn. One must really focus on prevention, educating the public and things so that you can prevent the condition from happening in the first place. So really, the focus should be on early detection, early diagnosis, and prevention. And for that, almost invariably, very simple things. Blood pressure checks don't require any test to be done. All you need to do is put a cough. And so if you go into hospital for whatever condition, even if it's malaria, even if it's diarrhea and vomiting, insist that your doctor should check your blood pressure. And the Sphix come in so cheap these days that everyone over the age of 30, 40 must have their own personal Sphix. And we must make an effort to make sure that we check our blood pressures, not necessarily every day, but at least 2-3 times a week. That way, if your blood pressure starts to consistently become high, you detect it early enough for you to be able to see a doctor.
Can I stop you there? So what you're saying is, and I need, this is very important. What you're actually saying is that whether you have hypertension or not, you need to have a SFIC.
Yes.
Because of that didn't come across clear. Yeah.
Whether once you're over the age of 30, 40, you must have your own SFIC, because blood pressure comes in insidiously and very often without any symptoms at all. In fact, you only develop symptoms when it has become complicated. And by that time, very often, it's too late to do anything about it. So you actually want to preempt it by making sure that you check on a regular basis. Ditto, I mean, I tell all my younger colleagues that no patient must come in to the hospital and get away without a urine analysis done. Urinalysis is a very simple test. It's very uninvasive. You don't take blood, you just give a urine sample. It's a very cheap test, relatively, wherever it is that you do it. And the amount of information that you can get from it is incredible. I mean, it will tell you whether there's protein. It will tell you that you're having the early stages of kidney disease. It will tell you if there's sugar in it, in which case it might be the early stages of diabetes. It will tell you if there's infection. It will tell you if your kidney is inflamed, if you're having red cells and casts in the urine. So there are so much information that can come from just a simple urinalysis, which ideally would not cost more than 1,000, 2,000 tests, naira to do, depending on where you're doing it. And that and a few other tests, of course, you can then do your blood sugar. Like I said, the glucometers are now available. And what I generally tend to advise most people is that once you approach 40, at least once a year, go for a general medical check. Give that to yourself as your birthday present. And just make sure that the very common routine tests are done. That way, you would detect anything that is ongoing at the early stages, and possibly at a stage when management by the appropriate specialists will make a difference. But it's also important to speak to the policymakers, the politicians, the people in the ministry. There should be regular programs in all of our public hospitals where we actually routinely do, widespread screening. Just go into the community and check the blood pressure of everybody there. Do a glucometer check for everybody there. Check the urine of everyone there. And you'll be amazed at the number of people previously undetected who you find have hypertension, have diabetes, already have evidence of some chronic kidney disease. And certainly for the primary care physicians, the general practitioners, we must recognize, just listening to the gentleman who spoke a few minutes earlier, how he actually had been seen by a primary care physician who was not able to control his blood pressure. There are certain things that require the services of somebody who is a specialist in that field. And once you find that the care that you're making available to your patients is beyond your capacity or is not responding to treatment, that's the point at which you refer. And there are always specialists. I think almost all our public hospitals now will have at least a physician, if not a nephrologist, or an endocrinologist if it's diabetes, that you can refer your patients to. And they probably have the skills and knowledge to be able to do a little more than what the primary care physicians. Well, this is not to underrate or underestimate the capacity and effectiveness of these primary care physicians, but for them also to recognize that at some point, it might be more appropriate to refer their clients if they're not getting appropriate response to the care they're given.
Thank you very much.